Hello, my name is Beata Chertok. I'm a researcher in gene therapy and focused ultrasound. I had the privilege to spend this past year as a fellow of the Focused Ultrasound Foundation and conduct my research at the University of Virginia. I'm excited to share with you my work on ultrasound-targeted delivery of messenger RNA to specific regions of the brain, an approach that we have recently developed, and the application of this approach for immunotherapy of brain tumors. Brain tumors are among the deadliest types of cancer known. They are notoriously refractory to standard of care treatment modalities, including surgery, radiotherapy, and chemotherapy. There exists a critical need to develop new approaches to combat brain tumors, preferably in minimally invasive ways that can spare the damage to the surrounding multifunctional brain parenchyma to give brain tumor patients a new hope. Antibody-based immunotherapy has recently risen to the forefront of cancer care. Antibodies have revolutionized treatment of several advanced cancers. Unfortunately, little success has been reached against brain tumors. Preclinical studies show very promising efficacy when immunotherapy against brain tumors is initiated at very early stages of brain tumor development. However, little success has been reached against established intracranial gliomas, a stage of tumor development that better reflects patient presentation and diagnosis. One of the major challenges is the transport barriers within tumors that impede access of large and hydrophilic antibody molecules into tumors after systemic intravenous administrations. My lab at the University of Michigan has recently developed a very promising approach that has the potential to overcome these challenges. We have developed a new method to non-invasively target messenger RNA to specific focal regions of the body, including brain tumors, using our engineered nanoparticles and focused ultrasound. In this scenario, instead of delivering antibody in its protein format, we deliver messenger RNA, a genetic precursor for therapeutic proteins, including antibodies, into target cells within tumors. The cells then leverage genetic information to manufacture therapeutic proteins in situ within the tumors, essentially serving as body's own drug factory. We have recently demonstrated therapeutic plausibility of this promising approach in subcutaneous tumor models using messenger RNA that encode for immunotherapeutic antibodies. These mRNAs were previously developed by our collaborators, Dr. Smith and Nair lab at Duke University. The objective of the present study was to assess the therapeutic potential of this promising approach against established brain tumors, leveraging MRI-guided focused ultrasound to deliver messenger RNA to brain tumors in mice. We first set out to validate our ability to deliver and express messenger RNA in specific target regions of the brain using MRI-guided focused ultrasound. We used a typical setup for MRI-guided focused ultrasound that is depicted in this image here. In a typical setup, a mouse subject is positioned supinely on a platform overlaying the water tank filled with water for acoustic coupling. The ultrasound transducer is positioned within the tank and can be moved in 3 dimensions using motorized positioners to steer the focus of the acoustic beam to the desired location within the brain. The whole setup is positioned within the MRI scanner. In the typical experiment, we would first take the pre-scans of pre-scans of mouse brain using MRI to select the desired target into which the therapy should be delivered. We would then position the focused ultrasound, the ultrasound transducer, such that its focus is steered into the target location identified by specific MRI coordinates. We would then inject the combination of nanoparticles and microbubbles intravenously into mice and apply sonications using our previously developed acoustic pulse sequence. Afterwards, we would validate our ability to enhance permeability of the blood-brain barrier at the targeted location using contrast agent gadolinium. Gadolinium is normally impermeable across the normal blood-brain barrier. However, once the blood-brain barrier is permeabilized using focused ultrasound and cavitating microbubbles, gadolinium can penetrate and can be detected as a hyperintense lesion on T1-weighted MRI scans. Thereafter, we proceeded to validate our ability to deliver mRNA and induce their expression at the desired target in the brain. We used a messenger RNA that encodes for reporter protein luciferase, the expression of which can be detected by bioluminescence imaging. We were successful in demonstrating that the expression of luciferase occurs indeed at the target region at the coordinates previously selected for acoustic targeting. After validation, we proceeded with our therapeutic study. Our experimental group comprised of was administered with messenger RNA that encodes for therapeutic antibody. The mRNA was encapsulated in our engineered nanoparticles, and the delivery was assisted with focused ultrasound and microbubbles. This experimental group was compared to multiple control groups, including non-treated controls and controls that were administered with standard therapy using recombinant antibodies. Our experimental timeline was as follows. We first inoculated the brain tumor cells into the striatum in mice to initiate tumor growth. Thereafter, we monitored mouse brains with MRI pre-scans to identify tumors which reached the preselected, the predefined tumor volumes. After that, treatments were initiated. Focused ultrasound treatments were delivered in 2 cycles, 2 days apart. For the standard therapy with recombinant antibodies, we used multi-dose regimen previously described in the literature. After treatments, we continued monitoring mouse brains with MRI to assess tumor growth. We also monitored the mice for humane endpoints to analyze survival. Our data revealed that standard therapy with recombinant antibodies failed to improve the outcomes compared to non-treated cohort. This result was consistent with previous reports that showed that recombinant antibody treatments failed to improve outcomes when the therapy was initiated at similar stages of tumor growth. In contrast, our experimental therapy was found to significantly reduce tumor growth compared to control treatments. In addition, our experimental therapy was found to significantly extend survival compared to controls. Our exciting results suggest that ultrasound-targeted delivery of messenger RNA to brain tumors has the potential to unlock the benefits of antibody-based immunotherapy for the treatment of intracranial gliomas. This promising approach warrants further evaluation. I would like to thank all of the people and agencies that made this work possible. First and foremost, the Focused Ultrasound Foundation that hosted me as their fellow this past year and that generously funded my work through the research grant program. I would also like to thank the members of my lab at the University of Michigan and my previous sources of funding for this project that helped me to leave this project off the ground. And of course, I would like to thank my collaborators at the University of Virginia and the Duke University School of Medicine. Thank you very much for your attention.